And I think we will still desperately need to see disciplined social distancing so that when people do go back to offices, when people do go back to school, there will be 2 meters between each person.
You must stay together. Whatever it takes, we will beat the coronavirus, and we will beat it together.
Boris Johnson today returned to the helm of government a month after being diagnosed with COVID-19. And boy, oh boy, a lot has changed in this battle against coronavirus. Lockdown has been extended and there doesn't seem to be a roadmap out yet. However, Boris Johnson did warn today that the public should be very wary of lockdown impatience, saying that we are coming to the end of phase 1, but we're at a very important point. So where to next? What should be at the top of Boris Johnson's inbox? And what does phase 2 look like? Let me bring in Dr Hilary Jones. Hilary, what was your reaction to Boris Johnson's statement outside Number 10 today? And where do you think phase 2 is going to leave us?
Hi, Dan. Well, it was good to see the Prime Minister back at the helm. I think that's the statement he wanted to make. He's back, he's going to be in charge, and he thanked the people who'd been deputising for him. But he also thanked, importantly, everybody who's been behaving responsibly in lockdown, because this has flattened the peak. It has allowed the NHS to cope, and he made that very powerful message very plain, that the NHS has coped, the peak has probably passed. But he said that although the tide shows signs of turning, it certainly hasn't gone out yet. And there's the risk that the tide could come back in if we ease lockdown too quickly and in too great a way. He said, didn't he, that we don't want to be in a situation of reimposing sanctions in the future because we see a rise in cases which overwhelm the NHS again. So I think it was balanced. I think it was positive. I think he sounded upbeat and Churchillian in his address. So I think it is important that we all realise that this virus isn't going to go away anytime soon. That it's going to take quite a long time to meet the demands and the challenges that it gives us, and we all still need to be disciplined and not break the rules at all, really, if we're going to get a handle on this and get things under control.
And just, Hilary, on a personal note regarding Boris Johnson, so it's a month since he had COVID-19. He didn't go on ventilation, but he did end up in intensive care, so we know he had this thing bad. In your opinion, is he ready to return to full-time work, or does he have to be careful about managing his workload?
I think he has to be careful. He went through a lot. It was touch and go, not according to him, but according to his nursing team and his medical team, and he would have taken advice. Some people recover remarkably quickly, even when they've been quite unwell, and other people take a lot longer. So I think probably he'll be delegating some of the work that he normally does, I imagine. He didn't look back to his complete normal self, I thought, outside Number 10, but definitely he'll be listening to his medical advisors, and if he feels that he is regressing again, no doubt he'll put his feet up a bit more. But hopefully he's completely well and on that path to full recovery.
Hilary, what should be the first thing that needs to be tackled in this new phase of lockdown?
Well, I think the next step will be to determine when a phased lockdown can occur. We're still seeing a lot of cases being admitted to hospital. We're still seeing a lot of deaths, not just in hospitals, but in care homes and in people's home environments. And we know that there are more people out there now who are capable of transmitting COVID-19 than there were at the end of January. And since the end of January, we've had over 20,000 deaths in hospitals and probably another 15,000 or so outside of hospitals. So, we've still got a very serious situation. We can't come out of lockdown too soon. But the steps we'll be looking at in the future will be when cases start to diminish. We'll be looking at who can come out of lockdown first, which are the least vulnerable groups, which groups are least likely to transmit the virus back to households where there are high risk and vulnerable people. And I think we will still desperately need to see disciplined social distancing so that when people do go back to offices, when people do go back to school, there will be 2 meters between each person and strict hygiene precautions put in place. We will need testing and tracing. And we have some very innovative technology at the moment. One in particular I'm very keen on, which is called the COVID-19 System Tracker app, whereby you can register free and enter any symptoms you have or not on a daily basis, so that data can be collected from millions of people potentially, and we can look back and see what symptoms occurred first, in whom, in which people, and at what time. And if they later tested for COVID-19, we can see what the early symptoms were, even before you would get the results of tests in those people. So I think epidemiologically, this will be a major step forward in helping us to see who's most at risk, why they are, genetically perhaps, when their symptoms started, what kind of symptoms they had. So I think it's that kind of technology which will help us also in the future.
Great news. Well, look, let's go to your questions. You can ask them, of course, using the hashtag Ask Dr Hilary. First one from Martin McClare Hills. I work as a mental health nurse in the NHS. I had symptoms of COVID-19 3 weeks ago, but I have been symptom-free for around 2 weeks. Will the antigen test still be worthwhile?
We think the virus persists in the body for about 14 days when one's been exposed to coronavirus. And that is why we say to people who suspect they've been in touch with somebody who's had the virus or has had symptoms to self-isolate for 14 days. We think that after 14 days, the virus has been overcome by one's own immune system, and therefore the virus is no longer able to be transmitted. So after 2 weeks, he should be fine to go back to his normal activities and shouldn't be transmitting the virus.
Colin Brumwell asks, when washing your hands, is there any benefit to washing around your mouth and nostrils too?
Well, that's an interesting question. Certainly, one of the reasons we wash our hands is because we put our hands to our face regularly and reflexly without even thinking about it. We tend to do this 2 or 3 times a minute. People don't always realize how much they're doing that, and it's touching things that transmits the virus to our hands and then to our face. So in theory, if we wash our hands frequently, we keep our hands clean and virus free. But of course, it's possible that we have virus transmitted to our faces. So in theory, if you wanted to go the whole hog and wash around your nose and mouth area, it would be helpful. Not many people do that, but in theory it would help. The only question would be whether doing that frequently would dry the skin of the face and cause some irritation. But it's not a bad idea, and it certainly wouldn't do any harm.
And final question today has been sent in from John Warren.
Oh, hi, Dr. Hilary. I'm John from North London. One of the 5 tests in considering lifting the lockdown measures set by the government is that there is no risk, and I repeat, no risk of a second peak of the virus. Won't there always be a risk of a second peak?
Gosh, yes, there'll always be a risk of another peak, not just a second peak, but even another peak after that, because the virus is still going to be circulating. So just coming out of lockdown doesn't mean the virus has gone away. It's still out there. There's still a great deal we're learning about this horrible virus. And whilst it's circulating, there will be cases admitted to hospital. There will be mortality. The key thing is that we don't rush out of lockdown so that the virus is transmitted rapidly amongst lots of different people. Social distancing will still be important. And what we hope will result from that there will only be a steady number of cases who become ill and are admitted to hospital, and only a trickle of people who are sick enough to lose their lives. But yes, the answer is there probably will be a steady number of cases. What we don't want is a spike, which means that the NHS becomes under huge strain again.
Thank you, Dr. Hilary. Dr. Hilary is back tomorrow answering your coronavirus questions. So all you need to do If you want to ask one, use the hashtag Ask Dr Hilary. Love getting your videos in particular. You can use that on any social media platform. Or if you want, you can also submit your question at thesun.co.uk/Dr Hilary or at talkradio.co.uk. We're back tomorrow with another edition of Ask Dr Hilary Coronavirus Explained.